Hi everyone, I'm Dr. Toor from Amplify Eye Care here in Olympia, Washington, and today we're going to talk through what you can kind of expect when you get an eye exam done. Now, of course, each office differs a little bit, but this is generally how we do it here. So usually, especially if you're new to the clinic, there's a little bit of paperwork for you to fill out when you first come in, and then when you are done that, usually there's a technician that'll take you to do some pre-testing. So they'll walk you through a few machines and gather some data that the doctor will use to help do your eye exam. So after that's done, the doctor will eventually call you back and get started on your exam. So initially, we just kind of talk through what the patient is there for that day. What are they noticing? Are they having some changes? Are they wearing glasses? And kind of their history of eye diseases, eye issues, things like that. And then we start by checking your vision through either your glasses, or if you don't wear glasses, just regularly. And then from there, I check a few just basic things here, like eye alignment, eye movement, your peripheral vision, just to kind of get the basics down. And then usually that's the next part, is to check the prescription. So to check if you need a prescription or how your prescription has changed. We usually do distance and up close. And then after that is usually more of the health check part of the exam. So depending on your age, eye diseases, health, and pupil size, we may or may not dilate the pupil. And the dilation is usually a drop that goes in and it helps the pupil, the black part of your eye, widen so that we can get a better look in the back where a lot of important health information is for the eye. So whether you're dilated or not, we usually get you into a machine called a slit lamp, which is pretty much like a big microscope with a light on it that helps us look at every structure of the eye and really close up of the eye. And we go from pretty much front looking all the way down to the back and make sure that the eye is healthy, or if there's anything we need to talk about. As at this point, we assess dryness, diabetes, if that's having an effect on the eye, checking for macular degeneration, glaucoma, and many things like that. After that, usually I will talk through with the patient all my findings, what the changes are, what I recommend, things like that. That's a great time to ask questions. And then we wrap up from there by getting the prescription. So it's pretty straightforward. And of course, at any point, if you have questions throughout the exam, you are always more than welcome to ask, but that's just kind of the general run through of an eye exam.